Welcome to the Sigma's 33rd International Research Congress. I will be presenting our research titled Impact of High-Fidelity Simulation Exposure of Nursing Students with Their Objective Structured Clinical Examination, a quasi-experimental study. The study was co-authored by Dr. Grace Medellin Castro and Dr. Niela Sacro Rosales, and we are all affiliated at Faqih College for Medical Sciences. The authors declare no conflict of interest, and this research did not receive any specific grant from funding agencies in the public, commercial, and non-profit sectors. Learning comprises of continuous internalization, observation, and application. Particularly, nursing students are expected to possess thorough knowledge and expertise in clinical procedures, along with appropriate attitude, competence, and confidence to deal with different scenarios in the healthcare setting. Thus, exposing undergraduate nursing students to an integrated curriculum with simulation-based learning is pivotal to their overall learning and performance. The Society of Healthcare Simulation defines high-fidelity simulation as a simulation experiences that are extremely realistic and provide a high level of interactivity and realism for the learner, and can apply to any mode or method of simulation, for example, human, mannequin, task trainers, or virtual reality. Therefore, high-fidelity simulation is being employed in nursing education. It allows learners to practice and apply their skills in a realistic, risk-free environment, while fostering independent clinical decision-making and improving their understanding of the effect of critical nursing actions on the patient's condition. It has gained recent prominence in nursing education and used to enhance the performance of undergraduate nursing students. The effects of simulation-based learning on clinical practice should be further examined. In this study, we aim to compare the OSCE results between the two groups of nursing students enrolled to 4 undergraduate courses: medical surgical, critical care, maternal health, and pediatric nursing, who underwent clinical training with or without high-fidelity simulation exposure. This study employed a quasi-experimental research design to compare the OSCE results of the student groups with and without exposure to high-fidelity simulation. Structured OSCEs are a reliable medium to evaluate the impact of high-fidelity simulation, as it measures and validates the student's ability to obtain and interpret data, solve patient problems according to the given scenario, conduct patient teaching, exercise communication skills, and handle unpredictable patient behavior during the course of nursing care. Since we utilize total population sampling to all the students enrolled in the 4 courses, the groups were categorized according to the course, topics relationship, and for the continuity of the scenario used during the simulation sessions, such as women's health and child health nursing were grouped together since they are related, and adult health 1 and critical care nursing accordingly. The students were exposed multiple times to high-fidelity simulation during their midterm and final period, and 2 OSCEs were conducted to ensure consistent and accurate results. The students were assessed by 2 trained raters in every stations during the OSCEs using a rating scale. Prior to the midterm and final OSCE, a pilot test was conducted to ensure that the rating scale was appropriate to assess the students. Items of the rating scale covered all important steps of the procedure. All indicators of the checklist were well defined, and the global rating scales were used for the raters to provide a holistic judgment on the student's performance. We utilized total population sampling, and thus included all students enrolled in these 4 courses. No participant dropped out during the study period. A total of 192 nursing students were recruited from the following courses: maternal health nursing, 50 students. Critical care nursing, we have 38 students. Child health nursing, we have 51 students. And adult health nursing, we have 53 students. All participants were female and were regular students. Those who started the BSN program at the institution from first year and continued till internship year. Age range 24 to 26 years old. The diploma students under the bridging program to BSN were excluded from the study. During the data collection, each high-fidelity simulation session was conducted as follows. 1. Students were briefed regarding the scenario and objectives. 2. Students from all courses were grouped during the simulation sessions, and each group, about 4 to 5 members, were allotted some time to comprehend and recall their knowledge, skills, and attitudes about the scenario. 3. Each group was brought to the simulation lab separately, while the other groups waited in the briefing room. The groups who completed their session were seated in a separate room till the others completed their sessions. 4. A debriefing session was conducted by a trained faculty using a gas debriefing model. Before the OSCE, the course coordinators and clinical instructors prepared and reviewed all objectives and scenarios with equipment needed in each station. The procedural rubrics used were taken from Mosby's Pocket Guide to Nursing Skills and Procedures for Adult Health Nursing and Critical Care Nursing. For Women's Health Nursing and Child Health Nursing, the procedural checklist was taken from Clinical Skills Manual for Maternal and Child Nursing Care. The OSCE stations were appropriately set up according to the blueprint. All rubrics used a 4-point Likert type scale, and the indicators used depended on the procedure. Raters and students were instructed about their role and their task in the OSCE respectively. OSCE raters comprised the nursing faculty members, including course coordinators and clinical instructors, while invited preceptors were staff nurses of Dr. Suleiman Faki Hospital. Station numbers were assigned to laboratories, and all the required equipment were arranged to avoid confusion. The standardized patients were also briefed and oriented about their roles during the examination. For the midterm, 7 OSCE stations were set, 5 for nursing procedures and 2 for written interpretation, each with an equivalency of 10% of a student's midterm grade. The average grade was calculated including the midterm OSCE marks of each student. For the final, 10 stations were prepared, 8 for nursing procedures and 2 for written interpretation, each with an equivalency of 20% of students' final grade. The average grade was calculated including the final OSCE marks of each student. The laboratory rooms were prepared. All equipment needed for the procedure and scenarios were posted outside the OSCE station's rooms. The organizer, who acted as a facilitator and timekeeper, ensured that the students were confined to the classroom and were only permitted to leave for taking the laboratory-based examination. Mobile phones and other kind of technology devices were prohibited inside the classroom. During the OSCE, the students were given 1 minute to read and analyze the scenario before entering the rooms. When the examinee entered the room, their time of 5 minutes began. 2 students each from Women's Health Nursing and Adult Health Nursing groups did not finish some of the procedures within the allotted time. The rubric indicator, not done, which has a score of 0, was applied to these instances. After the OSCE, the debriefing was conducted. The study findings reported that the combined mean of midterm and final OSCE results of the group of nursing students with high-fidelity simulation exposure and to those without exposure were 92.58 and 82.66 respectively, with a mean between group difference of 9.92%, with a p-value of less than 0.01. Our findings reveal that the high-fidelity simulation exposure, in addition to clinical training, enhanced the students' OSCE performance. The result of the study provides a strong evidence that high-fidelity simulation exposure of nursing students, in addition to the traditional nursing laboratory sessions and clinical training, produces positive impact in their midterm and final OSCE performance compared to those nursing students without high-fidelity simulation exposure but underwent traditional nursing laboratory sessions and clinical training. The repeated exposure to high-fidelity simulation training offers an advantage and enhances the student's performance in the OSCEs. Furthermore, the need for a standardized and systematized simulation model in nursing education is necessary to ensure achieving the intended learning outcomes in conducting high-fidelity simulations. Additionally, selecting the best model of debriefing will facilitate learning among all participants and improve their performances in the future simulations or in the actual healthcare setting. High-fidelity simulation-based training requires nursing students to apply their theoretical knowledge in a safe environment that stimulates the real clinical setting. This learning modality is effective for nursing students to develop high-level skills in decision-making and clinical competency based on their performance in the OSCE after high-fidelity simulation exposure. The findings of the study indicate the impact of high-fidelity simulation to the nursing students' performance in the OSCEs. However, the study was conducted with a small number of participants and it was only conducted in one setting. Moreover, the participants were only limited to female students, since the particular nursing program only accepts females as part of cultural practice and government policy of the country. Additionally, the use of procedural rubrics was a limitation, as they were adopted from course-appropriate reference books but not tested for reliability. Future longitudinal studies should be conducted with a multi-center design with multiple number of participants to facilitate incorporation of simulation-based training in nursing education and develop nursing students' clinical competency and enable practice readiness. Intensive training of faculty members in the simulation sessions would be necessary for nursing students, including structured assessment for their clinical performance and competency. This study provides evidence of the influence of high-fidelity simulation exposure to evaluate the student performance in the midterm and final OSCEs. Our study findings reveals that simulation exposure enhanced students' OSCE performance through the appropriate use of clinical reasoning, decision-making, and judgment while dealing with the provided scenarios. Thus, exposing students to high-fidelity simulation boosted their learning retention and improved their practical skills in performing nursing procedures that can be applied in the real world. The following are the references of the study, and before I end up, on behalf of the co-authors of the study, we would like to extend our gratitude to the Faculty College for Medical Sciences Nursing Department, faculty members, and preceptors involved in women's health nursing, child health nursing, adult health nursing, and critical care nursing, and the facilitators at the FCMS Clinical Skills and Simulation Center.